Welcome to the High School Athlete ATvantage, a podcast created by Drake University Sports Medicine faculty and staff for athletes, coaches, administrators, and other stakeholders in the world of sports. On the podcast, we have myself, Nate Newman. I'm the director of the Master of Athletic Training program at Drake University. I have 16 years of clinical experience as a licensed athletic trainer, and I have 8 years of experience in athletic training education. We also have Emma Nye.
Good morning.
A licensed athletic trainer working for Drake University Athletics. Emma has 5 years of clinical experience and has expertise in manual therapy, injury prevention, and cultural competence. We also have Stacy Nishinsky.
Hello, everybody.
An assistant professor of health sciences at Drake University. In her graduate program, Stacy studied integrated human performance and sports psychology. Stacy has 6 years of experience as a mental performance consultant and is currently completing her master's degree in clinical mental health at Drake University. Today we'll be starting a podcast series about mental health in sport environments. Across this series, we will be discussing topics such as the prevalence of and common presentations of mental health concerns in sport environments, basics of mental health first aid and trauma crisis intervention, strategies for supporting the mental health of student athletes, practical recommendations for facilitating referrals in urban areas, and practical recommendations for facilitating referrals in rural areas. So today we're just going to kind of get the conversation started in this area, and to really get started, let's have Emma. Can you tell our listeners, can you help them understand some basic facts about mental health in sport environments?
Yeah, of course. Thanks, Nate. So when we look at the most recent consensus statement published by the National Athletic Trainers Association on psychological concerns among secondary school student athletes, we know that approximately 20 to 25% of American youth meet the criteria for a mental health disorder. 32% of adolescents meet the criteria for anxiety disorder. 19% of adolescents are affected by a behavioral disorder. Approximately 14% experience a mood disorder, and 11% were impacted by a substance abuse disorder. Presentations of those anxiety disorders can surface as early as age 6, behavioral disorders by age 11, mood disorders by 13, and substance abuse disorders by 15 years old. So we're really looking at the secondary school population. If we put these numbers into perspective, kind of in the athletic arena, if you're working with a high school basketball team with a roster of 12 kids, it's likely that at least 1 and up to 3 of those student athletes may be experiencing symptoms of a mental health disorder. If we look at the NCAA level and the collegiate student athlete population, recent reports from the U.S. Substance Abuse and Mental Health Services Administration suggest that of the 45.9 million adults to age 18 and older, 20% have experienced a mental illness at some point. The prevalence of mental illness among 18 to 25-year-olds, so that college student athlete population, is twice that of those aged 50 years and older. According to the NCAA and Sports Science Institute, 30% of collegiate student athletes have experienced overwhelming anxiety during their time as a student athlete. Suicide is the second leading cause of death among persons aged 10 to 24. There was a study done by researchers at Drexel and Keene University, and they found that approximately 25% of Division I student athletes experience clinically relevant levels of depression, and female athletes more likely to experience depression than their male counterparts.
Thanks for that baseline data, Emma. I know hearing that data again, it's kind of sobering, just the prevalence of this potentially in our athletes, particularly in our high schools in the state of Iowa, how many athletes that are out there are experiencing these problems. Are those rates consistent with your experiences in working with high schools and college student athlete populations in Iowa?
They are consistent at the secondary school level. However, in my experience, the rate of college-age patients I've worked with seem to be a bit higher. So we use a mental health screening tool during our pre-participation physical exams to gather some data on prevalence, but also to just kind of generally start a conversation between the patient and the athletic trainer and begin to explore what resources they may need at an early stage. And unfortunately, I've had many of these types of conversations already with incoming freshman student athletes for this upcoming school year.
I've seen many conversations in the media, many stories out there that just suggest an increasing number, increasing prevalence over the last few years. What factors are contributing to this increased mental health concern among young individuals?
Yeah, so if we look at the consensus statement, they really provide a long list of potential triggering events or contexts that predispose young individuals to mental health concerns. For example, poor performance during their sport, interpersonal conflict, injury or illness, specifically concussions, history of violence, history of family or relationship issues, lack of sleep, history of abuse, family and individual history of mental health disorders or substance abuse, death, trauma, among others. So as you can tell, some of these factors are controllable to the student athlete, such as sleep, and some are far less controllable, like a family history of mental health disorders or abuse.
Stacy, let's bring you into the conversation here a little bit. You're a consultant in this area. Can you just kind of start with what are some of the more common behaviors or symptoms that parents, coaches, people around these athletes may need to be monitoring for?
Yeah, it's a good question, Nate. So the aforementioned consensus statements would suggest that if you suspect mental health concerns, or if any triggering events that Emma had referred to have occurred, it's wise to note any changes in sleeping or eating patterns, making sure to observe any unexplained weight loss or gain, looking for increased substance use, any signs of decreased interest or engagement in what would have otherwise been previously enjoyable activities like socializing or engaging in other sports or social activities, any talk of hopelessness, death, dying, or going away, looking for changes in concentration or memory, any signs of flat affect or dulled emotion and sudden changes in typical emotions, looking for things like fatigue, illness, injury. It's not uncommon to see excessive worry or fear or increased agitation and irritability. And as a particular note, and as we'll discuss further, I think in next or upcoming podcasts, but really, if you ever hear any comments at all about hopelessness, death, dying, or self-harm, this absolutely requires immediate intervention, as these statements can be indicative of suicidality. And when in doubt, consult with a mental health professional or a medical doctor in the case that a mental health professional may not be available. And if you're seriously concerned for the safety of that student athlete, I highly recommend just staying with them until you can facilitate proper care and next steps. Ideally, you would have some kind of organizational or professional action plan in place to follow in such cases.
Yeah, for example, if our staff encountered an athlete who was experiencing suicidality, our protocol is to immediately activate our emergency action plan, which kind of includes immediately referral to that mental health specialist that you speak of. And we have procedures in place that dictate how the patient will be transported to the mental health facility, means of communication, and follow-up care to ensure we're assisting the patient from recognition to return to play or return to the classroom. And by following this protocol, we can keep the student athlete safe, but also meet the standards of care expected in our athletic training profession.
That makes sense. Appreciate those insights from your practical experience. Stacy, a kind of follow-up question. I'm wondering if you can help our listeners further understand the continuum of mental health care in relation to sport performance. So what is normal functioning in terms of that mental health for the student athlete, and then what is more of that psychopathology where we need some help?
Yeah, it's certainly understanding that continuum and answering questions about the continuum seems to be increasing in prevalence in my conversations with staff members, coaches. It's hard, right? It's a kind of a gray area. And as you might imagine, that line between normal functioning and psychopathology is becoming more gray. Part of that is that we're getting better information about what that looks like. But as we, as sports scientists and mental health professionals, continue to increase our acumen in describing the actual continuum of care, you can start to think about the continuum having anchors of at least optimal mental health, which would kind of look like essentially no clinical symptoms, and on the other end of the spectrum having severe mental health disorders, which would look like many, many clinical symptoms. And most student athletes, in my experience, and I think just in the literature as well, most student athletes are competitive individuals, generally fall somewhere in the middle. It's rare to find someone that has no clinical symptoms whatsoever, because anxiety and depression and other emotions are, it turns out, a normal part of the human experience. But when those symptoms of anxiety and depression happen to be more pervasive in multiple areas of life. So it's not just constrained to sport. It happens in school or work, in their family lives, or you're seeing that those symptoms are persistent for weeks, if not months in some cases. And if those symptoms are posing barriers to typical function or engagement in typical life activities, so again, school, work, and sport, then this is telling us that this is more indicative of a clinically diagnosable mental health disorder. Being sad or bummed for a few days after something adverse happens is well within the normal range of psychological function. Being sad or bummed for a few months would not fall within that normal range, and thus that presents to us some solid ground for referral. Another situation that's common in practice is helping to delineate the difference between performance anxiety, which is when a student athlete might feel anxious or nervous about an upcoming competition, versus generalized anxiety disorder, which is feeling anxious and nervous in all areas of life, and it's not necessarily specific to any competitive or performance demanding environments. And I've had clients fall cleanly into both categories, and I've also had clients that have wavered between those two categories. So maybe they start in one, and we end up learning that it is more of a clinical issue, and we've had some that are more of a clinical issue, and after resolving a lot of those symptoms, then they're able to work with someone like a mental performance consultant and start to work on the performance side of their sport. And since I'm not quite licensed in Iowa as a mental health counselor yet myself, if clients for me present with clinical concerns as opposed to performance-specific concerns, my role is to help facilitate that referral and connect them to the appropriate qualified professional.
Thank you. This conversation, it's making me think back. I've had 16 years of experience, and there's a couple athletes coming to mind, in particular in the high school level. That's like, I know so much more now. I'm learning so much more. We're all learning so much more. How those could have been managed better, and how much I still need to learn just in this area. Mental health it's kind of one of those last areas that we don't understand. It's not like that ankle sprain, which we all know how to take care of. It's harder to really get on to take care of. Part of the things that I need to feel more comfortable with is what to say and what to do when that mental health concern arises, and then how I best can support that person. What does it take for practitioners, coaches, administrators, other stakeholders that are close to the athlete to feel comfortable operating effectively within that discussion?
Nate, I think your point about needing to know more is just spot on. It really is all about education and experience. The best way for any of us to gain confidence in our ability to manage demands is to prepare maybe a little bit more, and then maybe a little more after that, and then be willing to just go out and get the experience. It's certainly the staff members who are more familiar with the recent consensus statements and research literature in this area, or the practitioners that engage in continuing education, such as listening to this podcast or attending conference presentations, and think about mental health in the same way that they do physical health. These practitioners are the ones that seem to find greater comfortability and seem to be able to effectively support athletes when they need to the most. And if a student athlete suffered a compound fracture of the femur, I'm making this up because I have no medical knowledge or background whatsoever, so that sounds like a real thing,
It's
right?
a good example.
But everybody would say, you have a bone sticking out of your leg, you should probably see a surgeon or a doctor at minimum, and then maybe start some rehabilitation. But when a student athlete's struggling with something like depression, something we maybe don't understand as well, we're still as a society a little hesitant, I think, to say, you're experiencing something that's not healthy, and you should probably see a mental health professional and learn some strategies for how to help keep you healthy or manage those symptoms at least better. And alternatively, we recognize it, and sometimes what I see is we will actually just defer the entire situation to the mental health professional, as if the student athlete maybe just is broken temporarily, and they're hoping that the professional can return the student athlete once that problem is fixed, and as opposed to really looking at the student athlete more holistically and saying these are the physiological, these are the psychological, these are the technical aspects of their sport, and how all of those things play into how that person's going to develop and grow into life, particularly at the high school level, right? And really, this is just a person who, depending on the disorder, in some cases that condition, they're going to have to learn how to manage those symptoms the rest of their lives, and in other cases it could just be a matter of getting them the help they need to kind of restore that optimal mental health, and then they can move on with the remainder of their sport. But either way, or in either case, the student athlete is still in school, they have a social life, and they still need coaching. And our job as professionals, in my case mental performance consultant, and then certainly athletic trainers and coaches and anybody else that's really involved, our job is to support that person in the same way we would if the student athlete were rehabilitating and returning to sport following something like an ACL tear.
And I would also add that in my experience, one of the best ways a coach or administrator can help support that student athlete that may be struggling with a mental health disorder is to simply check in with them. Much like coaches check in with the student athlete and athletic trainer about limitations from injury in terms of practice or a competition, coaches can also check in regarding the emotional and mental wellness of their players as well. Oftentimes, I'll have a student athlete who's very hesitant about telling a coach that they're struggling with depression or anxiety, and they're kind of afraid of the ramifications of what that might mean for them and their status on the team. But if the coach or administrator makes it clear early on that these types of conversations are okay and even welcomed, the student athlete will feel much more willing to talk openly in the future.
Perfect. Stacy, Emma, thank you very much. I think this was a nice first conversation. Hopefully some of the main takeaways from this first podcast are just how common mental health concerns and disorders are among secondary school, high school athletes, collegiate student athletes. It's something that's out there even if we're not actively seeing it or can't put our fingers on it. It's occurring whether we want to, whether we're aware of it or not. That there's many contributing factors or triggering events that can predispose those high school athletes to mental health concerns and disorders. And then for professionals, education, preparation, experience can increase your comfortability and your confidence in your ability. And I think that is key. It's one of those topics that has a little bit of a taboo in society still. And so we sometimes are uncomfortable or we're not as confident in dealing with that. With this illness, we should treat it, as you said, just kind of like an ACL sprain, that fracture that occurs. It's the same idea, just making sure they get proper care. As Emma, Stacy, and I sat down for this podcast, we quickly realized there was a lot that we wanted to talk about. So as I said at the beginning, this is part one of a longer series on mental health. We'll be coming back in the very near future with another series of podcasts or a couple more podcasts in this area. We're going to delve a little bit deeper into this area. We're going to try to give you some more tools, some ways to really help those high school athletes, those college athletes that you're working with, just to make sure that they're getting that proper care that they are. If you have any questions about this, I know just looking at Stacy and looking at Emma, they are both okay with you contacting them. I'll just have them give contact information here real quick.
Yeah, so I think the easiest way is probably to just email me. And the first name is Stacy, Stacy .Gnasinski, Gnacinski @drake.edu.
And email is fine for me as well. It's emma.nye@drake.edu.
Perfect. And Stacy and Emma, they're both on top of this on a daily basis. They deal with this on a daily basis. Unfortunately, that they deal with it on a daily basis. But if you have any questions, feel free to get a hold of them. If you have any questions for me as well, the initial conversation I'm asking more, the moderator, I'll have some more things to say as we go deeper into some other topics. But my contact is Nathan, Nathan .Newman, Newman @drake.edu. And also, too, if you have any other suggestions for other ideas for the podcast, this is part of going to be a long-running series as we start our Master of Athletic Training program here at Drake. The idea is for our faculty and our students that are in the program to be involved. They're going to try to look deeper into some areas that be of interest to you, whether it's sleep, whether it's injuries, injury prevention, sport performance, whatever areas interest you. That's what we want to talk about. So if you have any questions or suggestions for future ones, please do get a hold of me. Just same email address, nathan.newman @drake.edu. Be happy to hear from me. And if you have any comments, feel free to share. Otherwise, hope you guys have a good day. Good luck with your upcoming seasons. And best of luck.
Excellent. Thanks for having us, Nate.
Thanks, Nate.